Hi, everybody. Welcome to tonight's Ask the Expert discussion. Tonight, we're talking about pregnancy and newborn care during COVID-19. This is the third installment in a series of programming that we've been providing about navigating through COVID-19. The first two segments were about back to school and mental health. So if you're interested in checking those out, we'll make those links available to you in the comment section below. My name is Jackie Furman with BJC Healthcare, and it is my privilege tonight to introduce our physician panelists. We are joined by Dr. Kathleen Jaeger. Dr. Jaeger is an OBGYN with the BJC Medical Group at Missouri Baptist Medical Center. Dr. Jaeger is also a PhD in immunology, so she brings an additional layer of expertise around managing through a virus. We are also joined tonight by Dr. John Cole. Dr. Cole is a Washington University pediatrician at the Kids Docs practice at the St. Louis Children's Hospital Specialty Care Center. Dr. Cole has a PhD in neurosciences, so we have plenty of expertise and education with us here on the line tonight. First of all, if you are joining us tonight because you are pregnant or you have a new little one at home, congratulations. This is an exciting time, and we are so excited to be here for you. And we want you to know that you're not alone. We hope that tonight's conversation will bring you some information, some guidance, and hopefully some peace of mind to get you back to the important work of celebrating and enjoying this very special time. Thanks to everyone who submitted questions in advance. It is not too late. You can leave your questions for us in the comment section below, and we will do our best to get to them all tonight. We will cover all kinds of general questions, all things belly to baby. We do ask that if you have specific questions about your medical needs or your baby's medical needs, that you contact your medical provider. Now, if you need help finding a medical provider, we're going to put some phone numbers on the screen for you. To find an OBGYN, you can call 314-675-1047. Now, if you're looking for a pediatrician for your little one, we can help you there as well. That phone number is on your screen. That's 314-720-5227. Now, those numbers are monitored from 8 a.m. to 6 p.m. Monday through Friday. Okay, now it's time to dig in. Now, before we take our first questions, let's meet our doctors and get some opening thoughts. Let's start with you. Hi, Dr. Jaeger.
Hi, everybody. You know, I think my opening message or overall message is just that parenting is tough and brings a lot of unique challenges. And parenting during a pandemic is certainly somewhat unprecedented. So we're here for you, we're excited for you, and we're ready to help you through this.
Now, speaking of parenting, I'd be remiss if I didn't bring up one of your other credentials. Now, you are the mother of an almost newborn, an 11-month-old, who's, I believe, turns 11 months today. So
yes,
congratulations to you.
Yes, ma'am.
And now Dr. Cole has, the other end of the spectrum, has a 17-year-old, so also has the parenting credential. How are you tonight?
I'm doing well. Thank you so much, Jackie. And it's an honor to be here to talk with the people watching and listening tonight. So thank you for tuning in. And as Dr. Jaeger said, there's a lot of challenges that go with parenting, but what we hope you don't miss tonight is that there's a lot of joy that goes with it too. And this is an exciting time for you and your families, and we want to celebrate that with you. But we're going to try our very best to give you some really good, helpful advice during this pandemic, because we're all learning about this novel coronavirus. And every day, Dr. Jaeger and I are answering many questions about how to deal with it. So we will do our very best to help you out tonight.
All right. So I'm going to start with a few childbirth, and pregnancy questions for you, Dr. Jaeger, and then we'll kind of bounce around a little bit as things get rolling. So first question tonight, Dr. Jaeger, is it safe to be pregnant right now?
Yeah, and this is one of those questions that's really individualized to each woman. We've started doing reproductive technology again, so we think it's safe to be pregnant right now, but really that depends on your other risk factors. Do you have chronic hypertension? Do you have other immunosuppressive diseases? How did your last pregnancy go? Did you have complications with that? So this is really one of those questions that's really tailored to each woman and should probably be addressed with their physician.
Why are pregnant women in general considered to be in the high risk group for COVID?
Yeah, pregnant women historically are at higher risk from respiratory disease, and we know this specifically from the flu. Data are somewhat limited with COVID so far, but we do know from a recent study that pregnant women have higher rates of ICU admission and higher rates of needing ventilatory support. So I think it has to do with the immune system and how that's modulated during pregnancy and how much reserve the pregnant woman has to combat the virus and combat any complications she may have. I will say we don't have a ton of data yet. We're still collecting data, but historical respiratory illnesses and the data we have so far would suggest that pregnant women are in a higher risk group.
So we had some questions about whether there are any ties to pregnancy complications or birth defects with babies who were, either mom was exposed to or had COVID during the pregnancy, or she was exposed to or had COVID at the time of delivery. Can you talk a little bit about that?
Sure, yeah. Right now, we don't think any birth defects are particularly related to COVID. One thing that we do kind of have our antenna up about is that pregnancy is a hypercoagulable state, meaning pro-clot formation. And we think that there's some data that COVID may be promoting clot formation as well, maybe putting pregnant women at higher risk of blood clots. So we've got our antenna up about that. Some OBGYNs are treating pregnant women with COVID with aspirin to help prevent that. And some women are being monitored with growth scans to make sure that their babies aren't growing a little bit smaller because of maybe the compromise that the mom has had from the respiratory virus. But as far as it goes with birth defects, we don't have any data that there's any correlation with birth defects and COVID.
So let's talk about the process of seeing you and the OBGYN in the office.
Yeah.
How are OBGYNs changing the way that you're handling prenatal visits, ultrasound visits? What should a mom expect at her appointment?
Yeah, absolutely. We're trying to make accommodations to make each visit as safe as it can be. Our whole staff is masked. We disinfect our office really frequently. We limit the patients in our waiting room. We have changed some of our visits to telehealth visits, meaning your OBGYN may alternate an in-office visit and a telehealth visit. As long as your pregnancy is uncomplicated and you don't have concerns, it's safe to do that. And we're just trying to do everything we can. We're pre-screening our patients before they come in to make sure they're not symptomatic or have a fever. I always tell my patients, I don't like being behind my mask, but I hope that you can see I'm smiling through it. We're just trying to keep everybody as safe as we can.
And I think you've done a great job of addressing this already, but we had a question from a mom who says she's pregnant with her second. Obviously, you've already outlined what's going to look different at the office, but what else should we expect to be different this time around?
Yeah, the office visits might be different, like I mentioned. She may be in less frequently because we do some of that telehealth visits. But I hope not that much more. I hope it's still an exciting, fun experience. I hope labor is still exciting for her. At the hospital, our staff is masked. We all look somewhat like aliens with our masks and our hair things and our eye shields, just trying to keep everybody safe. But I hope not that much more is different. I hope it's still a fun, joyous thing.
So while we're talking about the doctor's office experience, Dr. Cole, we had a mom say she's so nervous and doesn't want to bring her child out, especially to the doctor's office. Right. What do you tell her?
That's a great question, and it's a fear that a lot of parents have expressed recently. And what I can tell them with confidence is your doctor's office is actually probably one of the safest places you can go right now. Doctor's offices, including pediatric offices, have really put in a lot of time and thought into how to make it as safe of an experience as possible. So as Dr. Jaeger was mentioning with her office, obviously every worker in our office and every physician is wearing masks. We're also wearing goggles or face shields to protect our eyes, but also to put another barrier between us and your children and your family. We also are gowning and gloving when we are bringing in ill children. And that has even changed. So instead of having various types of appointments throughout the day, we are now specifically seeing newborns and well child visits in the mornings And then toward the end of the day, we're bringing in the ill children to see them. And obviously, if they have any kind of symptoms that are concerning for possible COVID infection, then we are making sure that we're wearing N95 masks, gloves, gowns, everything to try to protect everybody in that environment. The other thing that we're doing is we're slowing down the number of appointments that we make in a typical period of time so that we don't have families coming into contact with each other in the office. And some offices have even gone as far as having families contact the office when they arrive from their vehicle, and then they're told when a room is available so that they can come up and safely go into that room without being in a waiting room. So there's a lot of strategies that are taking place. Obviously, cleaning strategies to make sure that we're disinfecting all surfaces and all equipment is critical. Good hand hygiene is always important no matter where you're at. So with all of those things taken together, I think families can be reassured that your doctor's office is a lot safer than many other places that you would typically go throughout your day as you do your normal activities.
Great. Dr. Jaeger, this question came in from our comment section. I work in a place with a lot of people who may have COVID-19, and I also have a high-risk pregnancy. What additional precautions should I be taking beyond the PPE and the hand washing and all those measures that we know to take?
Yeah, and this is a really important question. With flu, the later in your pregnancy that you get infected, the more complications a pregnant woman may have. And we may deduce that that happens with COVID as well, though we don't have data supporting that just yet. So obviously the PPE is super important. The masks, if an N95 is appropriate in your working environment, then okay. Face shields, good hand hygiene, social distancing as much as you can. And some OBGYNs are recommending kind of a shelter in place, a self-enforced quarantine after 37 weeks to really limit your exposure and your potential risk with complications from COVID.
Now, that question was actually on the list in terms of do I need to self-quarantine? Should every pregnant mom quarantine at a certain point in their pregnancy?
Yeah, and I answer this question almost every day. I think if you can do your job safely and really have those protective measures in place, it may be okay for you to continue working as long as you're comfortable. If you can't have those safety measures in place, you may really need to think about a self-quarantine after 37 weeks to limit your risk of complications.
Dr. Cole, what about quarantining with the newborn once you're home from the hospital? Should you do that? And if so, how long?
So that's a great question. As Dr. Jaeger has alluded, we're still learning a lot of information about how COVID affects newborns as well as the family around them. And so in general, for any newborn, I typically tell them if we are born in the summertime, I like to have you at home for at least 3 to 4 weeks before we start introducing the baby to the wider world. In the wintertime during flu and RSV seasons for children, especially, then we expand that time period to 6 to 8 weeks. With COVID being, year round, it appears so far, we are still asking people for at least 4 weeks. I've heard some pediatricians going even up to 8 weeks, just because we don't know so much about this virus. The good news, at least in the early data, is that newborns and infants do not seem to suffer all that much if they are infected, and they seem to be infected at lower rates than other people. But again, that's preliminary data, and there have still been instances of babies being infected, and very rarely, but still concerning, there have been a few cases where infants have actually passed away. So we just always want to be cautious with a newborn. And so I think it's a good idea for a family, a mother and baby especially, to consider staying at home for those first few critical weeks, just so that the baby can grow and gain weight and let their immune system continue to develop. I think all of those things are really critical.
Let's talk about testing. So should a mom be tested for COVID-19 throughout her pregnancy, or will she be tested upon arrival to the hospital for delivery, Dr. Jaeger?
Yeah, not necessarily. We really want to prudently use our testing these days. So if a mom is symptomatic, certainly she warrants testing so that we can take the appropriate precautions. We are universally screening patients when they present to labor and delivery. So I can speak to my home hospital, which is MOBAP. When you walk in, you get your temperature taken, you get a list of questions asked to screen everyone at the door. And that goes for the mom and her guest as well. Actually goes for the physicians too. But we're not universally testing just yet.
Okay. What about babies, Dr. Cole? Should babies be tested, and do they have different symptoms for COVID?
So it's a great question. So first of all, with testing in pediatrics in general, because of the paucity of testing supplies right now, we really are trying to limit testing to the people who we suspect have it and who for whom it could make a difference in terms of isolation and quarantine parameters. For newborns, there really is no need to test unless the mother was known to be positive for COVID or suspected to be positive, or if the baby was exposed to an individual, whether in the nursery, within the family. And symptoms that would suggest that to a physician could be anything from fever, fussiness, not latching or nursing well or otherwise eating well, just acting irritable. So those are things that we would look for. But unfortunately, babies don't always show perfect signs of infection. And so we just have to be vigilant. And I tell my parents all the time, trust your instinct. So if there's something that you just didn't feel was right with your newborn, call your pediatrician right away, because we would much rather be able to reassure you that everything looks okay, or God forbid, if there is something going on, that we can catch it early and help take care of that baby, rather than to not trust your instinct and then end up with something more concerning occurring. So for right now, testing universally, like Dr. Jaeger is saying, is not recommended. If we get to a point where testing is more readily available and is easily done without having to wait for 3 or 4 days, then we might be able to discuss that later. But for right now, only infants that are born to mothers who are known to be positive, or if there's a suspected exposure, then we would consider that.
So let's talk a little bit more about when mom tests positive. And Dr. Jaeger, this one is for you. So if we have a positive test for mom, can you talk a little bit about how that affects the baby and kind of what's the protocol at the hospital in that case?
Sure. So first of all, if a mom tests positive during her pregnancy, not necessarily at the time of delivery, as long as the mom is stable, it doesn't necessarily change our management that much. Like I said before, your OBGYN may recommend aspirin, may recommend more frequent growth ultrasounds, just to be sure that everything is, the baby is growing correctly. If moms are sicker, certainly they need to be hospitalized and monitored much closer. Now, at the time of delivery, if a mom tests positive, they're in a special room to limit exposure of other staff and guests. And then we do take certain precautions with baby. This policy changes frequently, so I'm going to say make sure you touch base with your hospital about this if you are positive around the time of delivery. But as of right now, we are allowing rooming in of the infant with a COVID positive mother, obviously taking very close precautions. Moms are encouraged to be masked at all times. We do have physical barriers like an isolette that we can put the baby in, and certainly really good hand hygiene anytime the mom's going to be in contact with the baby. And a lot of that is in an effort to encourage breastfeeding and an effort to encourage mother-baby bonding. And those first few hours and days are critical for that. So we're taking every precaution that we can, but are still allowing rooming in of an infant with a COVID positive mother.
Let's talk more about masking. So we're hearing a lot about this right now from our audience. Does mom need to wear a mask during the delivery?
Yeah, so we're encouraging moms to wear masks, and for that matter, their guests as well. Certainly if they're walking the halls during their labor, or if they're in any kind of common area in the hospital, which has been limited quite a bit. When they're in their rooms, we're encouraging, but I will say not strictly enforcing a mask policy. As you can imagine, it is very hard to wear a mask and be in labor, much less push to deliver a baby. So we're encouraging that as much as possible, obviously with the understanding that there are times that that's just not possible. Our staff is protecting ourselves as much as we can, in light of that.
Is there a potential risk to the baby in terms of limiting oxygen or any concerns like that?
No, we would never do anything or ask a mom to do anything that would put their baby in harm's way. Absolutely not.
Dr. Cole.
Yes.
What about masking the baby?
No. Good question, but no. The American Academy of Pediatrics recently updated its advice back on August 12th. And what they wanted everybody to understand is that for children 2 and older, they should wear a mask when in public or unable to socially distance from other people that do not live in the household. But we should never, ever mask a child under the age of 2. And the reason why is we're concerned about the possible risk of suffocation. So absolutely no baby should be masked. And that's actually a good thing because then we get to see their beautiful faces all the time. But no, absolutely not. No masking.
Let me tell you how long my 11-month-old would keep a mask on.
Exactly.
So we have a new question in from the audience. If big brother or sister are going to school in person, does that present an additional risk if baby's at home of exposure, of infection? Are there any precautions that families should take in those circumstances? And Dr. Cole, I'll send that your way.
Oh, that's a very good question. So what I tell everybody is that in this pandemic, there is no such thing as zero risk. So unless you're living on an island with no one else around you and no one has visited that island, then you should.
Sounds lovely.
Yeah, which does sound lovely at a time. What you should do is weigh the risk, like Dr. Jaeger said before. You have to look at how can you, what kind of risk are you at? How do you mitigate that risk? So children going to school, that's a big topic right now. And there certainly is some concern among pediatricians and others that could kids potentially catch or spread coronavirus at school. We know from data that we've seen from around the world that the suggestion is younger children don't seem to be as likely to catch it or spread it, but there has been new data coming out that may question that a little bit. We know that 10 to 19-year-olds seem to have as effective ability of spreading and catching as adults. So what we have said is if everybody is masking, and again, now I just heard today that the Department of Elementary and Secondary Education came out and is recommending that all school districts in Missouri require masking for kindergarten through 12th grade, which the American Academy of Pediatrics would agree with. Then you significantly reduce the potential risk of spread or exposure. It doesn't mean it's zero, but if everybody, teachers, staff, administrators, and students are wearing their masks at school, then theoretically, you should not spread it as much. Obviously, social distancing while at school is important. Hand hygiene is critical. So what I would suggest is if brothers and sisters are coming home, the first thing they should do before they get around baby is wash their hands. You may want to have them change clothes. That's fine. The idea, though, is you're trying to mitigate the risk as much as possible. I do not think we need to make them go through chemical showers or anything like that, as some people may think, oh, I've got to really disinfect. But it's really the hand hygiene. And then, obviously, as we would say with any other illness, if your child has any other kind of respiratory symptoms or something like that, or a fever in particular, then they probably should isolate away from the baby until they are feeling better. But again, the data is changing daily, as Dr. Jaeger said. So we are doing our best to try to keep people updated with the most relevant information as we learn it.
Wonderful. I think what you just said is going to give peace of mind to a mom who asked a very similar question. I'm going to ask it again just so that you can answer it again here. Sure. Does the risk of COVID-19 outweigh the benefits of allowing the immediate family to bond with the baby? So again, household, independent of coming home from school or not, it's okay for big brother or big sister.
Absolutely. Again, as we said at the beginning, it's a challenging time for all of us, but we can't lose sight of what makes life so precious and what makes it so enjoyable. And one of the big parts of that is family. And, we want our kids to welcome their little baby brother or sister into the home. We want the baby to be exposed to their family because, as Dr. Jaeger said, it starts with that mom-baby bonding, but guess what? The other parents, the other children need to be able to bond as well, or else that baby loses out on a significant and important relationship. So I think that it is wise to ask the questions and say, how can we do it safely and effectively? But absolutely, I think we have to say that the benefits far outweigh the risks in terms of building those bonds within the family, at least in the immediate family. Certainly, as we get to later questions about other friends and family circles coming in to meet the baby, we can talk about those risk exposures. But within the household, I think it's really critical to build those relationships.
Okay, let's go there then, Dr. Cole. What happens when we're talking about extended family and friends? Is there a grace period before they can start to visit?
So again, like I said, I kind of go back to before taking the baby out in public, in public spaces or crowded spaces where there's going to be a lot of other people. I generally like to wait, 4 to 6 weeks, sometimes longer, depending on if the baby has any other concerning issues or conditions that you're dealing with. Having said that, welcoming people into the house, this is where parents are going to have to really be risk mitigators. They're going to have to ask tough questions, and they're going to have to instill hard rules. And what I mean by that is you are the guardian of your child, and nobody obviously is going to love that child as much as you do, and no one is there to protect them like you will be. So it's really important that you are comfortable and have given yourself permission to ask people, how are they mitigating their risk? So if obviously let's take, for example, grandpas and grandmas. We want grandpa and grandma to be there. We are excited. They're wanting to welcome that grandchild. But if they're going out to bars, if they're going out to large parties, if they're not wearing masks in public, you can't come see the baby right now, because quite frankly, it's not just putting the baby at risk, it's putting mom at risk. It's putting everybody else in that household at risk. And the same is true for aunts, uncles, friends. So I have no problem asking my family and friends, what have you been doing? Are you being safe? Are you wearing masks? Are you following the CDC guidelines? And for those that are, then that gives me some extra comfort. Again, I still have to weigh the benefit versus the risk. But for those that are clearly not following the guidelines, that's actually pretty easy for me. I would just say, thank you, but we'll see you when the baby's older and or when you start to change your habits, because I think that it's really important that everybody understands during this pandemic, this is not a votable situation. I think we've seen it politicized way too much, and it's unfortunate. We don't get to vote whether this virus infects us or not. The virus just does its job. All we can do is try to lower our risk as much as possible. And so the only way we can do that as a community is if everybody pulls the same direction and everybody is doing their part to slow down the infection rate. And unfortunately, we're seeing right now across the country, because there is a segment of the population that is still refusing to wear masks, that's still refusing to socially distance and avoid large gatherings. That is why we're seeing the virus run unopposed so far.
I'll just add to that really fast. I tell my husband that we're the gatekeepers for the baby. We're in charge, and we are, letting people in and out as we deem appropriate and as we think their risk is appropriate or acceptable. I'd also say that if you have a friend that just had a baby and you're a high risk person, don't go see that baby.
Right.
Send them a meal, send them a package, send them something fabulous, but stay away for a little bit. Or if they ask you what you've been doing and think that you're too much of a risk for them, give that parent some grace to make those decisions for their family. We just need to be kind to one another, because these are just tough times.
Absolutely.
Dr. Jaeger, let's talk a little bit more about visiting in the hospital specifically. So can my husband, my partner, my mom come with me in the delivery room?
Yeah, absolutely. I think that people got a little bit scared when things happened in New York so quickly and they limited all guests on labor and delivery. And that was what they needed to do at that time. But right now in St. Louis, we are allowing guests on labor and delivery. And I hope we don't take that away from moms because it's such a wonderful time and a wonderful experience that you should be able to share with your spouse or your mom, whoever you choose as your support group. So as I've said before, policies change every day these days. So check with your hospital before you go in. But as of right now, we're allowing 2 guests on labor with that mom. They need to be the same guest the entire time, her stay on labor and delivery, and then 1 guest on postpartum. Again, we hope that you feel supported and excited to share this with your family. We just want to do it in a safe way.
Would you recommend visits from siblings in the hospital?
I actually think that's not even an option. I'd have to double check, but I think there's an age limit on visitors. So I don't think that that's an option. I would say that siblings probably aren't the best ones to be your guest on labor and delivery or postpartum.
Okay.
I agree with Dr. Jaeger. My recommendation as a pediatrician would be to have the children excited to welcome baby brother or sister home. But right now, in this situation, we really do need to protect everybody, including those children. Like I said, even though we think that the rates of infection are lower, we don't know for sure. One of the things about going back to school is we're going to learn really quickly whether we were correct in that assumption or not. For the meantime, I think having the spouse or a parent be the visitor and let the children wait to welcome them home, and you can make a big deal out of it, and however you choose to celebrate that in your family, I think that would probably be wiser at this time.
So Dr. Jaeger and Dr. Cole, I'm going to throw this out there. I think either of you could answer this one. Talk about whether pediatricians can still visit and do their well baby visit in the hospital, and is that still happening?
That's a great question. And actually, to my understanding, I actually called around to a few hospitals prior to tonight's program just to make sure that I was giving correct information. So private pediatricians who have privileges at hospitals are still allowed to round on their infants, but an increasing number have elected to let the pediatricians in-house, the hospitalists, do that in the short term, just because, again, we're trying to minimize exposure risk to everybody. And for a pediatrician who's seeing patients in their office and out in the community, and then they come into the hospital, again, even if they're doing everything correct, which you would assume they are, there still is a slightly increased risk. So I think that I would talk with your specific pediatrician who you have hired to serve your family and see what their protocol is. But I know that a lot of pediatricians have elected to allow the hospitalists to take care of the infants while they're there. And then, of course, what's so critical about that is then coordinating care with the hospital and making sure that that baby has a checkup appointment with the pediatrician as soon as they come out of the hospital within the day or two, so that we can carry on the care that they've been receiving and making sure that they are doing well.
Dr. Jaeger, given some of the visitor restrictions that are in place, can a parent still have a doula or a birth coach with them?
Yeah, so I think it's really important to let each mom choose how they want to be supported during their labor and delivery. And if a doula is your choice, then that's great. And that gets to be your support person. It doesn't change the number of people you get to have as your guests. So I would say, you still get to have your 2 guests on labor and delivery. If one of those people is your doula, then that's great. We want you to feel comfortable and supported however that's best for you.
Okay, great. What about being able to tour the hospital in person or attend childbirth classes? Is that still happening right now?
Yeah, again, that's one of those things that's just changing every day on us. I was actually at MOBAP this morning and I asked our front desk just to confirm. that right now our hospital tours are virtual. And I think every hospital has their own website, but I'll speak to MOVAP just because I know that best. Our website has beautiful pictures of our labor rooms and our hallways and, kind of the lay of the land so that hopefully moms feel comfortable when they show up on labor and delivery. But the actual tour itself is being done virtually right now. That may change as numbers improve, but like I said, right now, virtual.
Dr. Cole, this one came in from one of our viewers. The holidays are still a few months away and things could still change, but would the recommendation now be to avoid extended family holiday gatherings with a newborn?
Oh, that's a great question. And boy, that's a tough one. And I'm probably going to get in trouble with my own family here. So what I would say is a lot of what we're going to be able to recommend. Yeah, a lot of what we're going to be able to recommend in the future is going to totally be dependent on what the viral level is in the community. If everybody gets behind wearing masks and socially distancing and avoiding large gatherings and keeping good hand hygiene going, and we're able to show that we are able to keep kids or get kids back into school safely while doing that, then I think that will give us more confidence to say, okay, we can maybe get together and do some of the things like Thanksgiving or the holidays that we typically do. But I'll be honest, if the viral loads continue to be what they are right now, and the positivity rates on the testing continue to be in excess of 5 to 7% in most places, I honestly don't know how we would do it without being at significant risk. So it's like Dr. Jaeger said, it's all risk mitigation. It's are you willing to put you and your baby at potential risk for bringing this back into your house? And also, because there's asymptomatic carriage as well, you could be carrying it, not even knowing you have it, and you could give it to somebody else. So you certainly wouldn't want to give it to your parents or grandparents or other elderly members of the family or those with pre-existing conditions, because we know that they are at a higher risk for complications. So I think every family is going to have to make that tough decision on their own. But my advice would be look at the data on the ground, listen to your health departments and your professionals, and talk to your doctor about travel plans before you commit to them.
Yeah, I think travel is a whole different ball of wax as far as like driving versus flying, that kind of stuff. But I think Dr. Cole would echo this too. If your family is already part of your quarantine or, part of your circle, my parents and my husband's parents are important to us for childcare. So they're already around my kids. So I think, a limited gathering with just the grandparents is something that I would find appropriate risk. But an extended family gathering, I don't know that I feel great about that right now. And like Dr. Cole said, it's going to depend on what happens in the next couple months, and each family figuring out what is appropriate risk for them and who's part of their quarantine circle.
Right.
Dr. Jaeger, this is just in from a viewer as well. Is it safe to have a traditional baby shower? And if not, are there any alternatives that we could pursue? Is a drive-by parade appropriate?
Yeah, this is a great question. I mean, it for an obstetrician to say you can't celebrate your pregnancy is sacrilegious, right? We want you to be excited. We want you to celebrate your pregnancy and have those baby showers. But we want you to do it in a safe way. So again, it's all risk mitigation. If you're having a baby shower and it's your parents and your husband's parents and maybe a sibling, and they're all part of your quarantine circle and they're being appropriate and taking appropriate precautions, I think that's great. If it's 100 of your closest friends, I don't know that that's appropriate risk right now, just because pregnant women are higher risk, like we already discussed. Certainly, if a pregnant woman has other comorbidities like hypertension, obesity, etc., I'm going to be even more restrictive about the social gatherings that she can attend. And certainly, if you can do your baby shower with masks, maybe they're cute little pink or blue masks, I don't know. If you can do your baby shower with masks and hand hygiene and social distancing outside with a limited group, I think that's great, and you should celebrate your pregnancy. But I actually hosted a Zoom baby shower a couple months ago, and it was wonderful. We had a great time, and it seemed silly at first, but it ended up being great. So, find a safe way to celebrate your pregnancy.
Dr. Jaeger, we're going to put your immunology background to work a little bit here with a couple of questions coming in. First here is from a viewer who says, I've heard that pregnant women are more susceptible to the flu, and you had mentioned this earlier, other respiratory viruses due to a weakened immune system. Since COVID-19 is a respiratory virus, are pregnant women more susceptible to COVID? Do you have a sense for whether one is more susceptible to the flu or COVID more so over the other?
Yeah, that's a great question. I think, as I mentioned before, we know historically that pregnant women are higher risk for respiratory illness. Particularly, our greatest example is the flu. And we know with COVID in particular, recent data has shown higher risk of ICU admission and higher risk of needing ventilatory support. So we certainly know that if a pregnant woman gets COVID, she's at higher risk for complications. Can you compare COVID to the flu? I don't know. I think that's kind of apples and oranges. We have better strategies for dealing with the flu. We've dealt with it for longer. We have a vaccine that we encourage every pregnant woman to get. So listen for your obstetrician to talk about that come October. But we have mitigation strategies in place for the flu that we just don't yet for COVID. So I don't know that I can compare COVID to the flu, but certainly a pregnant woman who gets COVID is higher risk.
Are there points along the continuum of the pregnancy that a woman is more vulnerable to viruses? Is it a trimester that you're safer?
Yeah, that's a really great question. Typically we think early in pregnancy when a woman gets a viral infection like the flu and is really febrile, they're at risk for complications with their pregnancy, meaning miscarriage, et cetera. And that's very early in pregnancy. Now, we don't have data about this in COVID in particular yet, but historically with viruses like the flu, that plays out. Later in pregnancy, when maybe a woman doesn't have quite as much reserve and there are physiologic changes that are actually happening with a woman's vascular system and respiratory system, they're at higher risk for respiratory complications. Like I said, the ICU admission and needing ventilatory support. There's just not quite as much reserve for a pregnant woman in late pregnancy to handle a virus and handle a hit like that. So later in pregnancy, you're looking at a higher risk for respiratory complications.
Dr. Cole, this one is from a viewer as well, and it deals with immune systems as well. When is the baby's immune system strong enough to start expanding its exposure outside the house and to other people?
Great question. So I think one thing, and Dr. Jaeger can speak to this as well, we often think that babies are really fragile when they come out and that they have no immunity. And nothing could be further from the truth. They actually have a pretty good, robust immune system to start because they wouldn't survive if they didn't. So having said that, though, it's really not so much that their immune system is not strong. It's that they just haven't had enough time to experience and build up immunities to certain illnesses. And certain illnesses, if they catch you unprepared, can be quite serious. So what the idea is we're trying to give the baby some time to grow and to continue to develop more immunity, because every second, every minute that we're out in this world, we're being confronted with viruses, bacteria, fungus, you name it. And our immune system does an amazing job of handling that. So what I would say is, again, typically that 4 to 8 week window is what I'm looking at in terms of trying not to bombard the baby all at once. But certainly we know from the fact that we give immunizations even from the day of birth, we know the baby's immune system is more than capable of handling things. It's just trying to control the rate of things coming at it all at once. And so basically, if we give the baby a chance to continue to grow and develop that immunity over the first few weeks, then they are better able to cope with things as they confront them. The other thing is I think it gives parents a chance and some time just to learn some of the mitigation strategies themselves about how to keep the baby and themselves safe. So it gets them into some good habits about how to stay away from people who are sick, good hand hygiene, other things like that. So there's a lot of good, just common sense stuff, maybe not perfect scientific stuff, but just good common sense stuff of why we tell parents and babies maybe stay home for the first few weeks.
Yeah, I think I remember when my baby was very little. And we talked about, babies having a fever within a certain window. And I'm not sure what that window is. Dr. Cole, you'll be able to speak to this, but
Right.
a very young baby that has a fever, unfortunately, needs to be admitted for a really thorough workup because we don't know where that's coming from.
Right.
And I was very strict about exposures during that time period, just because I don't want her to have to be admitted and have a lumbar puncture and this huge workup for a fever. And after that time, you can be a little bit more lenient with fevers in babies. So I was really cautious during that time period too.
Absolutely. And like Dr. Jaeger is saying, the actual time period that we look at is 30 to 60 days. So if any baby with a fever under 30 days is an automatic visit to the emergency room and checking out why that's happening. Now, we've been able over the years with more research and more study, we've been able to eliminate the automatic need for a spinal tap on every baby, like happened when I was going through residency training. But we still, blood, urine tests are not the most fun to gather on a newborn. And so 30 days for sure. And then some people will expand that depending on other symptomatology and risks, even up to 2 months of age. So that's why I said that 4 to 8 week window is really kind of the critical time. Not so much because the baby has, I want to make sure everybody understands this. Baby has immune system working. It's just we don't want to throw the whole kitchen sink at them at once. And so that's why we try to give them a little time to ramp up and build up. And then going back to another point that Dr. Jaeger had made before, one of the tremendous benefits of breastfeeding, which we try to encourage, is that moms pass on antibodies to their babies through their breast milk to help protect them as well. So it kind of works in concert with their immune system to protect them against certain illnesses. So again, that's another reason why it's really important to give them that launching time, if you will, in order to have the best chance as they enter into the brand new world.
Yeah.
Oh, I'm glad you brought up breastfeeding because I'm sorry, go ahead. You're probably about to answer my question, aren't you?
I was about to make my plug for the immunologic benefits of breastfeeding, but Dr. Cole just did a fabulous job.
Well, it's a perfect segue to our next question about breastfeeding. So if a mom tests positive for COVID-19, what is your recommendation around continuing to breastfeed, and are there additional precautions that she should take?
Yeah, this is a hot topic in the OBGYN pediatric world right now. Can a COVID positive mom continue to breastfeed? And I think the overwhelming answer right now is yes. And we want to support you to do that. Now, the same things I mentioned earlier for a COVID positive mom and a newborn. So certainly mask wearing 100% of the time they're around the baby. Really good hand hygiene before they touch or in contact with the baby. Physical barriers whenever she's not breastfeeding. And certainly if a mother chooses, she could pump breast milk and have a unaffected or another family member who doesn't have COVID give that to the baby. But the overwhelming consensus right now is yes, continue to breastfeed. The benefits outweigh the risks that we know of right now. Just do it safely with those precautions.
Absolutely. Dr. Jaeger said it perfectly. And what I would add to that is that this is a perfect example of how the data changing daily and evolving, and the discussion amongst peers and colleagues in the medical community changes and evolves. When COVID first hit, we were basically hit with a sledgehammer, and none of us knew what to do, what the risks were, who was most at risk. And so initially there was some thought about not having the baby room in with mother. Don't breastfeed if you're positive. But the more we talked about it, the more we looked at the science, the more we looked at the actual benefits that come from having baby and mom together and baby breastfeeding. It's overwhelmingly positive. And so it doesn't mean that we can ignore the risk. So what Dr. Jaeger said was perfect in terms of we still want mom to mask. We still want mom to wash her hands well before breastfeeding. If she's pumping, she should do the same things. And then what happens is that, again, we're blessed so far by the fact that it doesn't appear like babies suffer much from this illness, but we don't want to take that for granted. And so anything we can do to keep the baby safe and to help promote mom's nurturing of that baby, especially with breastfeeding, is ideal. So we again, that's where you do the benefit risk analysis, and the benefit clearly outweighs the risk.
There are actually studies ongoing right now looking at potentially anti-COVID antibodies being present in breast milk. So stay tuned. You know, this is probably one of the wonderful things that drew Dr. Cole to science too.
Yeah.
It's evolving every day.
Yeah.
We have to kind of adapt with it as it goes. But there are studies right now looking at anti-COVID antibodies in breast milk, which would be just really cool.
Exactly.
Wow, continues to be liquid gold, right? Breast milk is always the answer.
Absolutely.
So we have some questions about the length of stay in the hospital. So, and Dr. Jaeger, if you could talk about how soon before I can go home, and does that length of time in the hospital change for someone who has COVID?
Yeah. So, you know, I think we have to take this patient by patient. Certainly a vaginal delivery goes home typically faster than a C-section. Vaginal delivery is usually 1 or 2 nights, C-sections 3 or 4. But I always tell moms at least 24 hours. And that's so we can watch her blood pressure, watch her bleeding, make sure things are okay with her healing. I also always give my moms the caveat when I'm getting ready to discharge them that I'm your OBGYN. I'm okay with you going home, but we need clearance from your pediatrician as well. Because once they're out of mom's belly, I really defer to our pediatricians for their expertise. Now, some moms are requesting to go home a little bit earlier than maybe they would have before. And I think that that's fine for a low risk mom whose blood pressures are normal and is having a normal postpartum course. I think that's great. I know I was chomping at the bit to get home after I had my baby. I think that's fine. But, you know, if any mom has any red flags, there's no hesitation to keep them. Like Dr. Cole said about his office, you know, to be honest with you, the office and sometimes the hospital are safer places than other places in society right now. You know, we're all masked, we're all taking really extensive precautions, hand hygiene, et cetera. So I don't have hesitations keeping moms if they need to for their health or for baby's health.
So, Dr. Cole, I want to touch a little bit more on the conversation about the baby's exposure and kind of what about some of the more practical activities like going to the store with mom or taking a walk around the neighborhood? Is the guidance different there?
Who goes to the store anymore?
Touche.
Right? Don't we all just Amazon?
Yes, that's right. Right. So a great question. What I would say is that there are certainly opportunities for baby and mom and dad and others to get out and enjoy, especially this gorgeous stretch of weather we're having this week. Who knew this could happen in August in St. Louis? But it's things like walking around the neighborhood, and again, maintaining appropriate social distance from those not in your household, or wearing masks when you're unable to do so. No mask for baby, just to repeat. But we want to think of twice about going to public areas. So whether you're going to a place of worship, whether you're going to a grocery store, a restaurant, other things like that. Even though, again, giving full credit to many of those places that are doing their best as well to try to mitigate risk for people as they're trying to conduct their business, it's probably just not the best time for baby to be out in that situation. So again, going around the neighborhood for a walk, going to a park where you can maintain adequate social distancing is fine. But there are other considerations as well. You know, we have to think about, you know, not exposing the baby to too much sun. We have to make sure that we're not exposing the baby to too hot or too cold of temperatures. So there's other factors that go into that recommendation, but certainly with the pandemic, I would say I would probably stay away from too many public places that involve a lot of other people being, especially in an enclosed spaces like buildings.
We are running out of time. I cannot believe it. We are almost down to our last question here. This has gone by so fast. Thank you so much for all this great information. This final question, we're gonna combine it a little bit about again, those mitigation strategies. So if you could talk a little bit about, is mask wearing, is there a potential risk to the baby if a pregnant mom wears a mask? And maybe also throw in a comment or two about hand sanitizer. Is it possible to use too much and hurt the baby just by, by extension or by fumes? Just some thoughts on those mitigation strategies, please.
Yeah, sure. Like I said, I would never ask a mom to do anything that would jeopardize the health of their baby. There have been plenty of studies that show that mask wearing does not affect that person's oxygenation, and therefore I would not expect for it to affect baby's oxygenation. I think that the benefits of mask wearing far outweigh the risk at this particular point in time. And then hand sanitizer, that's not something that I would be too worried about. Again, benefits far outweigh the risk. There was just, I don't remember who put out the list, but a list of hand sanitizers that were not potentially safe because they had a certain kind of alcohol in them. And that's not coming to me right now, but certainly use a hand sanitizer that's safe, or just wash with soap and water for 20 seconds. My big kid and I count down our 20 seconds every time we get in the door. But the risk of those mitigation strategies, I think, the benefit far outweighs the risk.
Right.
And Dr. Cole, I'm assuming no hand sanitizer for little babies. We're not going to slather up those little baby fists.
Yeah, I would say really the baby themselves are not, unless they're crawling around or starting to walk like the 11-month-old is, they're not going to be getting dirty, quote unquote. So it's really the people touching them, handling them, holding them that are the bigger risk. So the thing we talk about with hand sanitizer, just make sure it's 60% alcohol or higher. 60% is plenty. And as long as you're not feeding it to the baby or putting it on them, you're fine, right? You laugh, but you get those questions sometimes.
I'm writing that down. Okay.
Yes. So the honest truth is that good old-fashioned soap and water work as good or better than about any hand sanitizer we have. I mean, hand sanitizer is great when you're out and about, on the go, need something quick, don't have the ability to get to a sink or a soap dispenser. At home, soap and water is an easy alternative, and it's honestly probably the best.
Yeah. Agreed.
We are out of time. We're just bumping into our window here. So before we go, though, I just want to make sure if there's anything I've forgotten to ask you or anything you really want to make sure you get across tonight, let's just take a moment for some final thoughts. If Dr. Cole, start with you, maybe?
Sure. Well, first of all, it's been a pleasure talking with everybody. Hopefully we've given you some good advice and good information to consider. The one thing I would add to what we had just discussed a few minutes ago is when moms decide to leave the hospital early with their OB's blessing and with the pediatrician's blessing, just make sure that you have that first appointment at your pediatrician's office. That is really critical, especially if your pediatrician was not the one that came and rounded on you in the hospital. It's really important for them to see that baby for the first time, to make sure that everything's going well, to review the medical record, and to make sure to answer your questions. So please, 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 before you are discharged from the hospital, make sure you have that first appointment set up with your pediatrician.
Dr. Jaeger.
Yeah, thank you again for having me. It's been really fun. I don't often get to talk about science and things at home, so that's great. I will just say what I said before, parenting is tough and has lots of unique challenges, and parenting during a pandemic like this is just totally unprecedented. So we're happy for you. We're excited for you. We're here for you. Everything I said tonight was kind of broad statements. So obviously each woman is their own pregnancy, and you should talk with your OBGYN about your individual risk and your pregnancy risk. But we're here for you. We're happy for you, and we can't wait to celebrate those babies.
And once again, we are here for you if you need a physician. So we'll put those numbers back on the screen. If you need an OBGYN, you can call 314-675-1047. That's 314-675-1047. For help finding a pediatrician, call 314-720-5227. And again, those numbers are monitored Monday through Friday, 8 a.m. to 6 p.m. Please like this page for ongoing updates and information, and just to learn about additional planned programming that we'll have for you here. And we'll make sure that a recording of this segment is available. And again, thank you so much, Drs. Jaeger and Cole. This has been a fabulous conversation tonight.
Congratulations to everyone out there.
Yeah, it's been great.
And most importantly, to all the moms in the audience and their families, congratulations.
Yep.
Thank you all for joining us. Have a great night. We'll see you next time.
Thanks, guys.